Living with Huntington's disease can present numerous challenges, but with the right medications, the journey can become a little easier. In this video, we will explore the top 5 medications that can help individuals navigate the neurological challenges associated with Huntington's disease. Understanding Huntington's disease. Huntington's disease is a genetic disorder that affects the brain, leading to the progressive deterioration of motor control, cognition, and behavior. It is caused by a mutation in the Huntington gene, which results in the production of an abnormal protein that damages certain brain cells. The disease typically manifests in mid-adulthood, although rare cases of juvenile onset can occur. The symptoms of Huntington's disease can vary from person to person, but they generally include involuntary movements, chorea, muscle rigidity, impaired coordination, difficulty swallowing, cognitive decline, and changes in behavior and personality. These symptoms gradually worsen over time, significantly impacting the individual's quality of life and ability to carry out daily activities. The importance of medication in managing Huntington's disease. While there is no cure for Huntington's disease, there are medications available that can help manage and alleviate its symptoms. These medications aim to improve motor symptoms, cognitive functions, and emotional well-being, enhancing the overall quality of life for individuals with Huntington's disease. Medications play a crucial role in managing Huntington's disease because they can help control the involuntary movements, chorea, that are characteristic of the condition. By reducing chorea, medications can improve mobility, reduce the risk of falls and injuries, and enhance the individual's ability to perform daily tasks independently. In addition to managing motor symptoms, medications can also help address cognitive and behavioral changes associated with Huntington's disease. Cognitive decline, including difficulties with memory, attention, and problem-solving, can significantly impact a person's ability to function in various areas of life. Medications targeted at improving cognitive functions can help slow down the progression of cognitive decline and enhance mental clarity. Furthermore, medications can help manage emotional symptoms such as depression, anxiety, and irritability, which are common in individuals with Huntington's disease. By stabilizing mood and reducing emotional distress, medications can improve overall emotional well-being and enhance the individual's ability to cope with the challenges of living with Huntington's disease. Common medications used for Huntington's disease. There are several medications commonly prescribed for individuals with Huntington's disease. These medications aim to alleviate symptoms, improve quality of life, and slow down the progression of the disease. The top 5 medications for Huntington's disease, based on scientific research and medical expert recommendations, are tetrabenazine, deutetrabenazine, amantadine, haloperidol, and clonazepam. Medication 1. Tetrabenazine. Tetrabenazine is a medication that works by reducing the amount of dopamine in the brain. Dopamine is a neurotransmitter involved in regulating movement, and elevated levels of dopamine can contribute to the involuntary movements, chorea, seen in Huntington's disease. By reducing dopamine levels, tetrabenazine helps control chorea and improve motor symptoms. Tetrabenazine is generally well tolerated, but common side effects can include drowsiness, fatigue, depression, and Parkinsonism-like symptoms. It is important to start with a low dose and gradually titrate up to the optimal dose to minimize side effects. Tetrabenazine can significantly improve chorea, enhancing mobility and reducing the risk of falls and injuries. Medication 2. Deutetrabenazine. Deutetrabenazine is another medication that targets chorea in Huntington's disease. It works by depleting presynaptic dopamine, similar to tetrabenazine. However, deutetrabenazine is considered a longer-acting version of tetrabenazine, requiring fewer daily doses. Deutetrabenazine has been shown to effectively reduce chorea in individuals with Huntington's disease. Common side effects include somnolence, drowsiness, fatigue, and depression. It is important to monitor for signs of depression and suicidality while taking deutetrabenazine, as this medication can increase the risk of these symptoms. Medication 3. Amantadine. Amantadine is a medication that has been used in the treatment of Parkinson's disease, but it also shows promise in managing chorea associated with Huntington's disease. Amantadine works by increasing the release of dopamine in the brain, which helps regulate movement. Amantadine is generally well tolerated, with common side effects including dizziness, dry mouth, and insomnia. It may not be as effective in managing chorea as tetrabenazine or deutetrabenazine, but it can be a viable option for individuals who cannot tolerate or do not respond well to these medications. Amantadine may also have cognitive benefits, improving attention and executive functions. Medication 4. Haloperidol. Haloperidol is an antipsychotic medication that can help manage chorea in Huntington's disease. It works by blocking dopamine receptors in the brain, reducing the effects of excess dopamine and thereby alleviating chorea. Haloperidol is effective in controlling chorea, but it can also cause side effects such as sedation, stiffness, and movement disorders. Parkinsonism-like symptoms, including rigidity and tremors, can occur with prolonged use of haloperidol. Regular monitoring is necessary to ensure that the benefits of haloperidol outweigh the potential side effects. Medication 5. Clonazepam. Clonazepam is a medication primarily used for the treatment of seizures and anxiety disorders, but it can also be beneficial in managing chorea associated with Huntington's disease. Clonazepam works by enhancing the activity of a neurotransmitter called gamma-aminobutyric acid, GABA, which helps regulate neuronal excitability. Clonazepam is generally well tolerated, but it can cause sedation, dizziness, and coordination difficulties. Regular monitoring of cognitive function is important while taking clonazepam, as it can impair memory and attention in some individuals. Clonazepam can be a useful adjunct medication for managing chorea and improving motor symptoms. Other treatment options for Huntington's disease. In addition to medication, there are other treatment options available for individuals with Huntington's disease. Physical therapy, occupational therapy, and speech therapy can help improve mobility, independence, and communication skills. These therapies focus on maximizing functional abilities, managing symptoms, and enhancing overall quality of life. Psychological support, counseling, and support groups can also play a crucial role in managing the emotional and psychological challenges associated with Huntington's disease. These resources provide a safe space for individuals and their caregivers to share experiences, receive guidance, and learn coping strategies. Furthermore, lifestyle modifications such as a healthy diet, regular exercise, and stress management techniques can help improve overall well-being and potentially slow down the progression of the disease. It is important for individuals with Huntington's disease to work closely with a multidisciplinary healthcare team to develop a comprehensive treatment plan that addresses their specific needs and goals. Conclusion: finding the right medication for Huntington's disease. Living with Huntington's disease can be challenging, but with the right medications and treatment strategies, individuals can navigate the neurological challenges more effectively. The top 5 medications for managing Huntington's disease: tetrabenazine, deutetrabenazine, amantadine, haloperidol, and clonazepam, offer different mechanisms of action and benefits. It is important for individuals with Huntington's disease to work closely with their healthcare professionals to find the most suitable medication regimen. Each person's response to medication can vary, and careful monitoring is necessary to assess effectiveness and manage potential side effects. By understanding the available medication options and their benefits, individuals and their caregivers can make informed decisions to maximize overall quality of life for those affected by Huntington's disease. In conclusion, while there is no cure for Huntington's disease, medications can significantly improve symptoms, enhance daily functioning, and improve emotional well-being. Combined with other treatment modalities and a comprehensive care plan, these medications can help individuals with Huntington's disease navigate the neurological challenges and live a fulfilling life.